We frequently ignore the important warning signals that our bodies provide us because of the chaos of modern life. Fatty liver disease is one such stealthy invader that quietly slinks into millions of people's lives. Ignoring its early warning signs could have detrimental effects on your health. We're going to take a fascinating trip today to find out the early warning signals of fatty liver disease. So buckle up and get ready for an exciting journey. What is fatty liver disease? Increased fat in the liver is a sign of fatty liver disease, FLD. Fatty liver disease may also be referred to as hepatic steatosis by your physician. However, in most cases of FLD, there are no symptoms. Heavy alcohol use has been linked to an elevated risk of one type of fatty liver disease. Nonetheless, an accumulation of fat within one's liver cells occurs as a result of excessive alcohol consumption. Therefore, the liver's ability to function is hampered. Fortunately, you can avoid or prevent FLD by making lifestyle adjustments. Types of fatty liver diseases. Fatty liver disease is classified into two primary categories. Number 1, non-alcoholic fatty liver disease. In the United States, 1 in 3 adults has this kind, which is extremely common. Although the exact cause is unknown, diabetes and obesity will raise your risk of developing it. It is not acquired from alcohol consumption, in contrast to the other main variety. 2 types of NAFLD exist. Simple fatty liver. This indicates that your liver is fat, but it may not be inflamed or that there is liver cell damage. It typically doesn't become worse or result in liver issues. Simple fatty livers are present in most NAFLD patients. Non-alcoholic steatohepatitis, NASH. Compared to a basic fatty liver, this is far more dangerous. If you have NASH, your liver is inflamed. Liver scarring conditions including cirrhosis and fibrosis, as well as liver cancer, can be brought on by the inflammation and damage to the liver cells that occur with non-alcoholic steatohepatitis, NASH. These issues may result in liver failure necessitating a liver transplant. NASH affects 20% of individuals with NAFLD. Number 2, alcohol-related fatty liver disease. This kind, which affects roughly 5% of Americans, is less frequent and is brought on by alcohol consumption. Because of this, things normally get better when you cut back on alcohol. If you continue to drink, ALD may result in major issues. These consist of enlarged liver. You might have pain or discomfort on the upper right side of your abdomen, though symptoms aren't usually present. Drink-related hepatitis. This is an enlargement of the liver that can result in fever, vomiting, nausea, abdominal pain, and jaundice, yellow eyes, and skin. Cirrhosis due to alcohol. This is a hepatic accumulation of scar tissue. Along with the same symptoms as alcoholic hepatitis, it can also cause large-scale fluid accumulation in your abdomen, which your doctor will refer to as ascites, heightened hepatic arterial pressure, bleeding internally, perplexity, and alterations in conduct. Enlarged spleen, a little immune system organ located inside the ribcage. A deadly liver failure can occur. Fatty liver disease associated with alcohol usually occurs first. After that, it may worsen and develop into alcoholic hepatitis. It could develop into alcoholic cirrhosis over time. What are the fatty liver disease's initial warning signs? Usually, normal checkups or tests for other health concerns are conducted when it's identified. The initial symptoms are tiredness. After a good night's sleep, you wake up with an overpowering feeling of tiredness instead of feeling rejuvenated. One of your liver's first warning signs of a possible fight with fatty liver disease is fatigue. Let's stop this cunning sleep thief in its tracks by listening to our body's subtle clues. Pain in the abdomen. Have you been suffering from stomach pain or discomfort that you cannot explain? This is the moment to stop and pay attention to your body's gentle reminders. A persistent feeling of fullness in the upper right side of your belly or a dull discomfort are 2 possible symptoms of fatty liver disease. It's possible that your liver is trying to get your attention, therefore don't ignore this warning. Inexplicable weight gain or loss. It's time to solve the enigmatic metabolic conundrum that may be connected to fatty liver disease if your weight has been fluctuating for no apparent cause. Weight increase that seems out of the ordinary or sudden weight loss could be signs of a liver problem. It's time to solve the riddle and take charge of your health, so don't allow your body's mysterious signals to go unanswered. Skin changes. There is more to your skin than meets the eye, as it's the largest organ in your body. Any abrupt changes such as jaundice, yellowing of the skin or eyes, black spots, or obvious blood vessels should be closely observed. These indiscernible messengers can be indicating fatty liver disease. Your skin talks volumes, so pay close attention and take quick action. High blood sugar. It's time to pay attention if you observe an increase in your blood sugar levels without any apparent cause. Insulin resistance and fatty liver disease frequently coexist, raising blood sugar levels. This gentle reminder can be your liver's plea for assistance, so pay no attention to it being a coincidence. Carefully check your blood sugar levels and get medical attention if you see any persistent anomalies. It is crucial to remember that these symptoms and indicators can also be linked to other medical disorders and are not exclusive to fatty liver disease. For a comprehensive assessment, it is imperative that you speak with a healthcare provider if you have any of these symptoms or if you have risk factors for fatty liver disease, such as obesity, type 2 diabetes, or heavy alcohol intake. In order to determine the state of the liver and rule out other possible causes of liver disorders, the diagnosis usually entails a mix of medical history, physical examination, blood tests, and imaging procedures, such as an ultrasound or CT scan. It can be very difficult to manage fatty liver disease and stop it from progressing to more severe forms, like non-alcoholic steatohepatitis, NASH, or cirrhosis without early detection and lifestyle adjustments. Which signs might indicate a more severe version of the illness? If fatty liver disease is not well controlled or treated, it may develop into more severe and advanced types. The more severe and obvious symptoms that come with the more advanced stages of the illness, such as cirrhosis and non-alcoholic steatohepatitis, NASH, include constant and increasing stomach pain. As the liver deteriorates, there may be an increase in the intensity and duration of abdominal pain, particularly in the upper right side of the abdomen. Jaundice. Jaundice is characterized by a yellowing of the skin and eye whites. It can happen when diseases like cirrhosis seriously affect liver function. Ascites. An accumulation of fluid in the abdominal cavity that results in discomfort and swelling in the abdomen is known as ascites. It is a typical side effect of more severe liver disease. Easy bruising and bleeding. People with severe liver disease may have easy bruising and prolonged bleeding from small wounds because their liver finds it difficult to manufacture the proteins essential for blood coagulation. Hepatic encephalopathy. A syndrome that can arise in severe liver disease is characterized by confusion and mental abnormalities. Confusion, trouble focusing, memory issues, and even altered consciousness might result from it. Unintentional weight loss. A notable and inadvertent loss of weight may indicate a more advanced stage of liver disease. Weakness and fatigue. As liver function declines, weakness and fatigue may get worse. Itchy skin. An accumulation of toxins in the blood can cause pruritus, or itchy skin, in patients with severe liver disease. Spider veins and skin changes. People with advanced liver illness may have spider veins, spider angiomas, and other skin changes such as palmar erythema, red palms. Gastrointestinal bleeding. Varices or enlarged blood vessels can develop in the gastrointestinal system as a result of cirrhosis. These vessels can bleed, resulting in symptoms like bloody vomit or black tarry stools. What steps should you take if you see these signs? It's vital to keep in mind that not everyone with fatty liver disease will advance to severe stages, and that many patients can control and even reverse the illness with lifestyle modifications like losing weight and eating better. Consult a healthcare provider for an accurate diagnosis and treatment plan. Blood tests called liver function tests are used to evaluate liver health and damage, as well as to determine the underlying reasons for your symptoms. Fatty liver disease may appear to be a stealthy invader, but it's important to pay attention to its warning signals. You can take charge of your health and stop the spread of this sneaky illness by learning to listen to your body's whispers and identifying the early warning signs. Recall that your body is an incredible communicator, and it's your responsibility to interpret what it's saying. With this information in hand and a will to protect the health of our livers, now is the time to take action. Don't delay any longer.